So this video is to explain a little bit more about the document hierarchy and how to save documents, and to help you understand the importance of saving documents in the right place. And this is predominantly so you can find them. As a record builds up, there'll be vast numbers of healthcare professionals saving different bits of information, and if you don't file it in the right place, then trying to get that record out will be like finding a needle in a haystack. So this is a list of the rather small number of bits of information that's been created on this patient, so it's not a problem. But if a patient has had a long and protracted admission or multiple admissions, there will be vast bits of information put in by doctors, by nursing staff, by physiotherapists, occupational therapists and pharmacists and everybody else. And if filed appropriately, we can now filter these using this filter tab and actually try and find bits of information based on who entered it, when it was entered, and most importantly where it was stored. So when you create a document, you have to choose a template, which is the format of the document that you'll be well and truly familiar with, and the key bit is the type, and this is where it gets stored. This is the location, and this list is pretty mind-blowing. Clearly, if you had to go through this every time you wanted to save a document, then it would be virtually impossible, and the likelihood of choosing the wrong document type would be very high. So it's crucial that you filter this down to only the document types or the document locations that you require. Now this is easy to do, but not entirely intuitive, and to do so you need to go to clinical notes, and then if you come up to documents and options, here is the list of document types. Now I'm going to, for example, if I work on the AMU, admitting patients, I want the admission clerking note, I want the consultant ward round note, I want a handover note perhaps, but I also work on the elderly care ward, so I want to do an elderly care progress note, and perhaps an elderly care handover note. So those are the only document types that I really require. If I now come to clinical documentation, and rather than all, I choose personal, then you can see that when I choose the document type, these are the only ones that I have to see, and I have a much more sensible and achievable list to make sure that I file documents in the right place.